Thank you very much. As kindly introduced, I am Baek Eunseong, the representative at Global Care. The Global Care has working on 3 activities. One of our special support was set to Daegu, which is the hot spot in Korea. But Dongsan Hospital was actually very strategically located with many patients of new cases. And so Dongsan Hospital and another governmental hospital was the hub of those hospitals, a public health system for new cases of COVID-19 patients. So we have been to Dongsan Hospital, and that hospital had 1,000 beds. But still, only 2 beds were available there, but they actually concluded to extend and increase the number of beds. But there are other conditions that were not very advantageous for COVID-19 patients' treatment. Also, medical staff was short. So we tried to help new cases being treated well in Daegu without any referral to other regions. So we supported Dongsan Hospital. We spent over 750 million won, and a majority of them were spent on machines and medical equipment. And at the same time, also there were some budget needed for additional medical staff. But the Korean Society of Critical Care Medicine helped this. Next slide. Okay. As you understand, critical patient treatment requires critical and special care. And as you know, the severely ill people of COVID-19 require the most help. And there are some categories under the COVID-19 patients with the severe symptoms. And out of them, the critical patients needed a lot of help, and we focused our effort on them. That time, the number of ICU was short, but we expanded it to 20 in Dongsan Hospital. And discussing with the Korean Society of Critical Care Medicine, we were able to send 32 specialized medical staff to Dongsan Hospital. And as you understand, the majority of medical staff wanted to quit their jobs in hospitals. But unlike at the beginning, when we saw some help and gift from private sectors, over time, such support came to be short. So we actually helped and provided the gift and some some relief kit to them, including rice cake. And this is the progress of a number of critical patients in Daegu. You see? So how many people were covered by Daegu Hospital? 20% at the minimum, up to 1/3 at the maximum were covered by Daegu Dongsan Hospital. And you see the red line. There are only 2 hospitals in Daegu to treat COVID-19 patients. One is Daegu Dongsan Hospital, and the other is Daegu National Medical Center, Daegu Medical Center. But at the very beginning, Dongsan Hospital was not one of the hospitals which provided the help to COVID-19 patients. And Daegu Dongsan Hospital was supposed to treat only the patients with moderate illness. But at the eventually, Dongsan Hospital had to take care of over 400 patients. Next. And we at Global Care have been discussing how to respond to COVID-19 patients and the situation. We knew there were so many people in need, particularly the senior members, senior citizens who are living alone and people with disabilities. So we sent a emergency relief kit to them, and we learned that they were not really able to eat properly. And we also understood that there were some self-employed people who needed our help. So we sent side dishes and fresh meals to them. That was a unpacked delivery for 2 months. And also, we also delivered strawberry to the market to help strawberry farming families. And another activity that we did is this. We published the reports about the analysis on COVID-19 and the situations. And next. Well, the satisfaction level was really high regarding our help. And what's the difference between COVID-19 and other infectious diseases? COVID-19 is such a new infectious disease, so we didn't fully understand what this is about. And even those specialized doctors have been changing their words between March and now. And asymptomatic patients were not fully analyzed. And this is also mutated. And we can never be sure. We can never be sure if a vaccine can help. And as you understand, this is an infectious disease. And even this morning, we listened to the news that even Gwangju, another city, has seen an increase in new cases. And even in Daegu, we see more cases now. And this is a respiratory infectious disease, so anyone can be exposed to this infectious disease. And next. And worldwide. This is a worldwide issue. Even when we solve this problem, if others don't take part in, then we can never resolve this issue. As you understand, 10 million people worldwide were infected. And in May, we have seen a few days when we didn't see any new cases, but we are now seeing an increase in Beijing and in our country as well. And the DNA analysis in Beijing, coming from the new case in Beijing, showed that the virus was mutated to European version. And it was really challenging to acquire supplies, including ventilators. But the U.S. banned the export of the medical equipment, so it was hard to acquire the supplies. And what we learned from Daegu was that it was really hard to engage the private sector. But yes, we also learned that the control system was needed. And we needed to be responsive very fast and consistently. And also we found that there were not many and sufficient numbers of public health care systems. And army doctors were also deployed to Dongsan hospitals and other hospitals. They were really excellent, but they were army doctors, not private professional doctors. So we were the first organization who sent professional doctors to Daegu. We recruited specialized doctors for a critical patient treatment. It's quite hard to acquire such a professional doctor. And when they work in Daegu, then they have to actually take a break for 1 month. So it was hard to acquire such doctors because most of hospitals don't actually allow them to work in Daegu. But we did. We made it. Well, this is what we did. Let's do what we used to do. So we sent professional nurses and medical staff quickly for 1 month, and also 1 week or 2 weeks, depending on their titles. We sent a relief medical staff and manpower, like relief specialists for 1 week and social workers for 2 weeks. And also we sent a side dishes and fresh meals to them. And such voice was raised by the local communities in Daegu. And we reflected it. And Daegu Dongsan Hospital did a lot. Well, this morning in Gwangju City, the spaces for critical patients are short. I read the news this morning. And in June 15, Daegu Dongsan Hospital reopened, but they didn't really see many patients coming. And that's a big sacrifice from the Daegu Dongsan Hospital, that they actually treated COVID-19 patients. It was really thankful that we already had social workers and other professionals, including medical doctors and nurses. And the professors from respiratory department and were gathered together in our table. So we were able to be very responsive to local needs. And from those patients with moderate illness to those with severe illness were taken care of by ourselves. So we also wanted to do more, but for some part of activities, we were not able to get the approval from the city government and central government. And also, I would like to emphasize that the private sector is a lot larger than the government has been thinking. Many NGOs and non-profit organizations wanted to help Daegu, but our wish was not reached to them because of some regulations and rules set by the government. But anyways, we helped them, and we were contributive to the better condition of COVID-19 situation in Daegu. So the public sector and the government has to think about how to collaborate with the private sector. So far, they've been thinking that we can do it alone without the private sector. If we can work together with private sector, it would be good. But if not, that's okay. That kind of mindset and approach should be removed. And such lessons should be delivered to the government, and the government has to rethink these aspects. Thank you.